Gerald Friedman's joining us. He's professor of economics at the University of Massachusetts Amherst, my undergraduate alma mater, and he has a new piece in dollarsandcents.org which talks about what would a potential single-payer system actually look like as far as what would it cost, where would the money come from, and would it be communist socialism like we hear so much in the mainstream corporate media. So Professor Friedman, I think a good place to start would be, before we talk about how such a system would be funded, what it would cost, which you outline in the paper, don't you?
Yeah, well, it would cost a lot less than we're spending now. That's kind of the bottom line. We're spending now $17 out of every $100 in the U.S. economy on healthcare, which, that may be fine. People may be happy spending a lot of money on healthcare. The problem is we get pretty bad, relatively bad healthcare for what we're spending. And we could probably get better healthcare for spending less money. That certainly is the experience of every other advanced economy.
Okay, now when you say we could spend less, that's $17. Where do you see it dropping to?
It depends on how it's done, but we could certainly anticipate savings of $500 billion, which would get our spending down to something like 12 cents out of every dollar, $12 out of every 100. Then I would expect that some of these savings we would automatically use to fix some of the most pressing problems in the healthcare system. For example, 15% of Americans don't have health insurance, and their life expectancy is 6 to 8 years less than that of people who have health insurance. Another 10% or so of Americans don't have health insurance at some point during the year, or have really inadequate health insurance, type of health insurance that when you get sick, you find it doesn't cover very much.
Sure.
Yeah.
So as a percentage of GDP, though, for comparison, does the U.S. spend, how do other countries at the same level of development as the U.S. spend as a percentage of GDP on healthcare?
About 11%, which is really interesting because our system, we think, a lot of people talk about the U.S. healthcare system as, okay, we have a private system based on employer, health insurance linked with employment, and that's the way it's been. Actually, we've had a major change in our health system about 40 years ago. 40 years ago, most employment-based health insurance was done through Blue Cross Blue Shield, which was a community-based plan where everybody in the area would have similar coverage at similar prices. Since then, we've fragmented the system so that, there are like hundreds of different plans offered by dozens of different companies. Canada, the same time that we were moving in that direction towards a more private, competitive, for-profit system, Canada in 1971 adopted what they call Medicare, which is a universal single-payer system, single-payer for each separate province. Now, at that time, the United States and Canada were both spending about 7% of our gross domestic product on healthcare. Since then, our spending has gone up to 17%. Their spending has gone up to 10, 11%.
That's definitely, those are the numbers I think we need to be looking at, which you won't hear about when this is discussed, when the main criticism of it's too expensive. You don't hear those numbers, do you?
No. Our system is the one our for-profit system is the one that's expensive. And it does a bad job. Life expectancy has grown faster in Canada than in the United States during this time. We're spending more and more money, and every other advanced capitalist economy is having a bigger increase in life expectancy for less money.
Sure. Well, let's assume we could agree that the system would work better, which not everybody would concede to us. But for the purposes of this conversation, let's assume we can at least agree on that. Then the next obstacle people like to talk about is cost. And when you outline this, I think it's 1.35 trillion cost. you
Yeah.
break down exactly how this would be paid for. What's the biggest component? Because people will assume, hey, my taxes on income are just going to go up, and you know, it's class warfare, et cetera. How would you actually pay for this system, though?
Well, first of all, it it would be paid for with taxes that for most Americans are less than they are currently spending for health care, for health insurance, or for out-of-pocket health care costs. For the 80 to 95% of Americans, they would be spending significantly less on buying health insurance through taxes than they're spending now. For the very rich, the program we outlined, which includes taxes on financial transactions,
The Tobin tax, right?
the Tobin tax, which is a good thing to do anyway. You know, it obviously doesn't have anything directly to do with healthcare, but it is a tax that we should be imposing to discourage the type of reckless financial behavior that led to the crisis that the crisis was still in. So a Tobin tax, a tax on surtax on high incomes, a payroll tax that would replace what people are now paying, or some of what people are now paying. And these taxes together would generate the money that we need, even allowing that we'll be expanding coverage to all Americans and providing everybody with access to quality health care.
Sure, and this even takes into consideration the fact that if people had coverage that they weren't paying for each individual visit, you might see increased utilization, right? Things people put off, they would no longer put off. You're even considering that in the cost, are you not?
Yeah. One of the most shocking statistics we have now is that about 40% of people without health insurance do not fill prescriptions that are written by the doctor. They can't afford the prescription. They just don't fill it. Some doctor told them you should get this. They don't get it. 15 to 20% of people with health insurance do not fill prescriptions.
Incredible. So when we look at the bottom line, if we take into consideration the additional taxes being paid as well as the savings to people from not buying health insurance, everybody up to the top 4% of income earners, correct me if I'm not, would have a net gain in disposable income, right? The amount that they would save is going to be far outweighed by the additional taxes they would pay on healthcare, for healthcare.
The amount that they pay on taxes would be outweighed by the amount they save. Yes.
Right.
They would save money. And the biggest savings would go to the lowest income people. I mean, this would be a major step towards reversing the great flow of income up the ladder that we've had in the last 40 years. We've had a huge transfer of wealth and income up to the richest people. Actually, since I was just looking at these statistics, since the recession began, all of the increase in income that our country has had, the economic growth we've had with the recovery, has gone to not all, 93% has gone to the wealthiest 1%.
We're certainly familiar with those numbers. The next discussion, of course, which we don't have time for today, but we'll have you back for, is will this more likely happen under individual state single-payer systems? Will it happen under expanding Medicare, et cetera? But no time for that today, unfortunately. The article is at dollarsandcents.org. We've been speaking with Gerald Friedman. He's professor of economics at the University of Massachusetts, Amherst. Great piece and really a pleasure to speak with you. And your cat is now joining us as well. So thanks to both of you, really.
Yes, that's Jet Pup. Yes.
All right, thanks, Professor.
Thank you very much.